confused is that I see your cholesterol was at 3.5. It was 5.68 before. You're saying you're taking the same medications. Is that correct?
If that's what your paper says.
Think about my papers. What pills are you taking?
It should be just whatever is written down there. Nothing's changed.
Okay. Now I have 3 lists of medications. You had a balloon, an angioplasty to your heart. It says that you're taking 6 medications. It told the dietitian you're taking a different set of medications, and your family physician has a different list of medications.
I'll be the one with the latest date on it. This one's...
I'm confused.
I'm lost. If you're confused, what chances have I got? You're the doctor. You're the one that's supposed to know what I'm on.
How am I supposed to know what you're taking? What goes into your mouth? See, what do you think? What do you do? How many pills are you taking a day?
Whatever that says. I don't know. I just put them in the thing and take them on Sunday night. But yeah.
Where's you have that red folder we gave you?
Yeah, I think Hayes got it.
Where is it?
Well, to tell you the truth, it was on the seat of the pickup and the windows down. Out it went, and I got going on the highway, so you gave me another one. I'm not going to lie to you.
I'm really lost myself. Howard, is that I'm looking at your pills here. What are you taking?
All whatever it says on that list, nothing's changed. It's been the same, I think.
So if I look at all these different lists and all these pieces of paper here, you had an angioplasty or balloon to your heart back a year ago.
Right.
And it shows that you're taking a series of pills. One's called a beta blocker to prevent a heart attack. You're on 2 blood pressure pills and 2 cholesterol pills. Now, your doctor sends you in and says you have a poor response to medicines. And the list you gave the dietitian is different than the list that when you left the hospital, and it's different than the list that your family doctor sent in.
Yeah.
The only person who knows what they're taking is you. And we gave you that red folder to keep track of your health, because what we realize, medical errors are common. And to maximize prevention, we need to be partners in this. So tell me a little about what happened to that red folder.
Yeah, well, what did I do with it?
Did you lose it?
I think I must have lost it because I haven't seen it for ages.
Okay. So the first step is to do something about this. So you can see that I can understand why your doctor is confused. He wants to give you more medication.
I can see your point now.
And so what should we do right now? Because your cholesterol one time is really good right now. Yeah. It was really bad before. Yeah. It sounds like you weren't taking your pills before, you're taking them now. Am I correct?
Yeah, there was a couple days I missed. I know that because we went up north fishing and I forgot to take them with me, so. But I take them, yeah, I'll start. I got to start taking it more serious.
So from now on, can I count on you to keep a list, update it, and keep that red folder?
Yeah, it's a deal.
Don't look at the camera, look at Jim today, and tell me about your health. Well, welcome first of all.
Well, thank you so much. No, health's very important. It was 13 years ago that I had an angioplasty in this hospital, and a month later my grandson was born. And that's the incentive to be healthy, because I can spend time with him week in and week out.
Fantastic. And what you bring with you today?
Well, I brought with you today is yesterday my results. I went to the lipid clinic yesterday and got some results, and they look better than they did 2 months ago.
Great. And what are you doing for activities?
Activities, basically in the summertime I cycle approximately 20 kilometers 5 times a week, Aquafit 2 times a week, and then in the winter time I do Aquafit, weight training, and cycling at the Y. I'm taking Crestor, and I'm taking...
Do you have a list of them?
Well, yes, is that in my file? Let's just check and see if it's in my file. So before I bring the card up, there it is right there.
I don't believe this.
What?
You brought your list of pills.
Well, yeah, you have to. You never know when you're going to be in an accident. Anything can happen. First question you ask you, what's medication?
Okay. Now, this is what we need to do. Should be the obvious thing to do, and it effing annoys me that I bang my head every day that people are not like yourself. Congratulations.
Oh boy, I should buy a lottery ticket today. I'm going to buy a lottery ticket today.
Put the thumb up.
Okay, thumbs up.
All
Okay.
right, here we go. Perfect.
Okay.
You go to Florida,
Yes.
and you have no chest pain, no dizziness,
It never had it, no.
and you had your angioplasty back in 1999.
99, that's correct.
Any chest pain since then at all?
One day at the Y, I was on a machine, and I think I mentioned it to Dr. Fallon. I'm going back now maybe 6 or 7 years, and he said, "You're a pretty hyper guy." He said, "Let's do another angiogram." And I had that done, and it might have been indigestion. It only just happened once. I got a couple thumps.
When was the angiogram done?
I'm going to say about 6 years or so.
Okay. What did that show?
159 over 98.
We got 173 over 91.
Oh.
Holy shit. I see you got your blood pressure at home. It's much lower.
Right. When I'm here, I'm not listening to classical music and sitting in my wingback chair.
Okay. So, what did we do wrong? We didn't measure blood pressure properly. Blood pressure should be actually measured in a relaxed environment. Not when you're in the middle of the doctor's office chatting away.
Exactly.
So this is actually an example when the blood pressure is 173 over 91. If I get caught speeding, my blood pressure is about 200.
Right.
And if I get anxious, blood pressure tends to go up.
Right.
So we have different ways of measuring blood pressure.
Right.
Let me just tell you about that. The first way is in the doctor's office. So when you come to the doctor's office, you should be relaxed when the blood pressure is measuring.
Right.
We clearly didn't do that here.
Right.
The other important thing is blood pressure at home. So I noticed that you measured your blood pressure and it's much lower. And if the blood pressure is somewhere less than around, ideal blood pressure 115 over 75 or thereabouts, but blood pressure at home less than 130 over 80-ish or so is pretty respectable most of the time.
Right.
The other thing to have this ambulatory 24-hour blood pressure machine that we can use as well. It gives an average blood pressure
Right.
measuring every half an hour or
Right.
so while you're awake and less often at nighttime. So message here is that I don't want to rely on the blood pressure here
Right.
by itself, and the measurement at home is important. So thank you for measuring that.
Okay. Can I just add?
Shut up for a sec, just kidding. Is that everybody should be measuring their blood pressure and bring them in. Go ahead, your turn.
Well, the thing is, the white coat syndrome, it does affect me, no doubt about it. So I had the is it called the halter?
Or the 24-hour ambulatory.
That's right. I took that darn thing, and it was the 120. It was normal, except the first 2 times it measured it, and the day I took it in, the last one I measured it, and when I got up in the morning, it went beep. There were 2, but you take those 4 out of there. Was right on.
So
right.
fantastic. So I think what I'm hearing here is that if people measure their blood pressure at home,
Right.
do it properly,
Right.
bring in the diary,
Right.
saying that sitting on the kitchen table or it's in my head, not good enough.
Right.
And when in doubt, we can do this 24-hour blood pressure machine.
Right.
So we want to make sure we classify people properly.
Right.
There's an entity where the blood pressure is low at the doctor's office and high at home. That leads to more strokes and heart disease. So we need to identify all these blood pressure readings.
Right.
Thank you, Mr.
O'Connor.
I'm going to say Mr. Great Guy
Well, no.
for doing all the right things.
Well, right. I mean, there's, that's what you're supposed to do. I mean, I don't know, it's not rocket science.
What can I say? Thank you so much. Perfect.
Okay.
Get the thumbs up again.
Right.
Okay, when Dr. Kerner sent me home after I had EKG, my wife and I went out and picked strawberries. I get home from picking strawberries and Dr. Kerner calls and says, you got to go to the hospital because they're going to put a pacemaker in. And the hospital's going to call, which they did, and I was in the hospital by 6 o'clock. They had the pacemaker installed by noon hour the next day. Perfect.
Now, a very important question. What happened to those strawberries?
Oh, I ate them.
Go.
Who says tofu can't be good? Tofu mousse. What's that?
I got some more. So what's in it?
Fantastic. Thank you
I'll
so
see you
much.
tomorrow, guys. Thanks, Dr. Kern.
Want to have some tofu mousse?
No, thank you.
Oh, delicious.